Welcome to your screencast on the nerves of the lower limb, where we will discuss nerves from the lumbar and sacral plexi. Majority of the image you will see in this presentation come from Netter Atlas of Anatomy, as well as University of Michigan's Blue Link. Next, let's talk about the lumbosacral plexus. Within the lumbar plexus, we have two main nerves that we have to know, and that is the femoral nerve and the obturator nerve. Pictured here is our femoral triangle. To refresh your memory, the femoral triangle is made up of three borders. This is your medial side, lateral side, and of course this is superior and inferior. So to review the borders, you have your inguinal ligament, which has been cut out of the way, but you can imagine it is where my arrow is coursing. Then you have your adductor longus as your other border, and your lateral border would be your sartorius muscle, which has been cut, but it would extend down this way. And so you can now see an imaginary triangle in this region. And within our triangle, we have your femoral vein, femoral artery, and femoral nerve. So the femoral nerve is the most lateral. And another way that I like to remember the order of the blood vessels and nerve is to remember in this area, the van drives up the hill. So V serving for the femoral vein, A for the femoral artery, and N for the femoral nerve. The van driving up the hill, starting medially, moving laterally. And here we can see the obturator nerve. Obturator nerve courses through the obturator foramen, and here we can see it lying external or superficial to your adductor brevis, coursing down to give supply to the medial thigh muscles. Now let's look at some of the branches from your sacral plexus. We have your sciatic nerve here, and the best way to find this is to look at a posterior view of the thigh and the gluteal region, which is what we're looking at. And once we move away the gluteal muscles, specifically gluteus maximus, we are able to see this small muscle called the piriformis, which means pear-shaped. So you can kind of see the pear shape of this muscle here. And if you look inferior to this muscle, you should see 88% of the time the sciatic nerve coursing inferiorly. So here's our sciatic nerve. It is the largest nerve in our body. And the sciatic nerve is actually made up of a tibial and common fibular nerve that are surrounded by a common epineurium. Once we follow the sciatic nerve inferiorly, so you can kind of draw a schematic in your notes here if you'd like. Here's our sciatic nerve coursing down the posterior thigh. And once we get to the posterior knee, termed the popliteal region, it divides or bifurcates into your tibial nerve and common fibular nerve. So you would draw another line down as your tibial nerve and another line moving laterally, that would be your common fibular nerve. You may have also heard this called the common peroneal nerve. Peroneal is an older term, whereas fibular is a newer term, but you should know both as both are used in practice. From there, your tibial nerve will continue down along the leg, and once it reaches the foot, it will divide into a medial and lateral plantar nerve. So this is a inferior view of the foot. Here at the number 8, we can see the medial plantar nerve, and alongside it is the medial plantar artery. At the number 9, you could see the lateral plantar nerve, and alongside it is the lateral plantar artery. If we go back to that common fibular nerve, it is going to bifurcate into a deep and superficial fibular nerve. So in order to find the deep fibular nerve, we are going to look at the anterior leg compartment. So to get a better idea of how these nerves course, I want you to imagine the popliteal fossa behind the knee here. That common fibular nerve that came off of the sciatic nerve wraps itself around the head of the fibula that would be in the region of my arrow. From there, it is going to bifurcate into this deep fibular nerve. The deep fibular nerve courses alongside the anterior tibial artery, and we could find this lateral to the tibialis anterior muscle that has been dissected away here. So in your schematic, you can add this line and label it deep fibular nerve. Now to find the superficial fibular nerve, we need to look at a lateral compartment of the leg, and you can find deep to the fibularis longus the superficial fibular nerve. So in our schematic, we can add superficial fibular nerve. Now, you may have already guessed this, but the deep fibular nerve will supply the anterior compartment of the leg, and the superficial fibular nerve will supply the lateral compartment of the leg. And the way I always remember this is by thinking of how superficial people stand. And that's usually with their leg laterally. So this helps me remember superficial fibular nerve supplies lateral leg. People who are deep thinkers stand with their feet together, pointed anteriorly. And so I think deep fibular nerve supplies the anterior compartment of the leg.